Good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your Friday morning. We're just a few moments away from hearing from Dr. Scott Harris, the Alabama State Health Officer, as he gives his weekly COVID-19 press briefing. It appears that Dr. Harris has begun, so we will send you there live now.
Died from COVID-19 since this pandemic began. That's really a staggering number. More than 670,000 people in this country have died. Our country, with less than 5% of the world's population, has 15% or more of all the deaths that we know about. Here in Alabama, we continue to see deaths at a really high rate. Unfortunately, we released some numbers earlier this week that I wanted to cover with you again today. This past year, 2020, is going to be the first year that we know of in the history of our state where we actually had more deaths than births. Our state literally shrunk in 2020 based on the numbers that we have managed to put together, and actually by quite a bit. We actually recorded, I want to make sure I give you these numbers exactly right. 64,714 deaths is the still preliminary number that we have for deaths in 2020. We'll continue to update those. It takes really about a year to get your total data on a previous year, and that compares with about 57,641 births that we have a record of. We have data going back to the first decade of the 20th century, so more than 100 years, and that's never happened before, nor has it ever even been close before. In World War II or during the flu pandemic of 1918 or World War I, we've never had a time where deaths exceeded births, and until this past year, and it's certainly possible that could happen this year as well if we continue on the same rate that we're seeing now. We're continuing to have double-digit numbers of deaths reported on most days. A lot of the preliminary information comes through us from our hospitals. The Hospital Association, I think, is going to begin publishing their death data. We're very glad they're doing that. Remember that it's not always going to match ours right away because it takes us a little bit of time to do the investigation and confirmation on that. But we, again, have had numbers of deaths over the past several days that are, typically 40 or 50 or sometimes 60 deaths a day. We are actually going to add to our totals today 192 deaths since yesterday. Those did not all occur yesterday. Some of those are several days old, or some may even be a few weeks old that we're just now able to confirm. But the numbers of deaths, unfortunately, have not declined at this point. Remember, that is a lagging indicator. That's one of the last things that we see improvement on. We've had a total of 7 pregnant women we know of who've died from COVID-19. We actually have, on average, for the past week, about 23 pregnant women who are hospitalized with COVID, by the way. A total of 7 deaths that we have a record of. We are seeing a little bit of a decline in our total numbers of hospitalizations. That's certainly a good thing. In a way, we don't want hospital numbers to continue to increase. I would just say very respectfully and with compassion, there are 2 ways people leave the hospital, and one of them is not very good. And while we're having double-digit numbers of deaths today, that certainly in part accounts for the declining number of hospitalizations we're seeing. We still have more patients requiring critical care than we have critical care beds. That number actually was down to 11 more yesterday. That's certainly better than it's been, but it still means we don't have any available ICU beds in Alabama. And that's a really challenging problem just for people with non-COVID illnesses or people who have a stroke or a heart attack or a car accident today. It's going to be very challenging to figure out where you can get critical care if you need it. So that problem has not really improved much. We have about 53 children in the hospital as of this morning with COVID diagnosis. I believe the number was 6 of them who are requiring mechanical ventilation at this time. Let me move on to cover just a few other things. We have now virtually all of our school districts reporting to our school dashboard. We're very grateful for the Department of Education and their assistance in working with this. We had a total of 6,382 cases reported to us from school districts to the dashboard this week. That number is a little bit lower than last week, and that represents actually all but 2 school districts in the state reporting. So we're certainly appreciate their cooperation and getting those numbers out there. We actually measured in the past week about 2,900 school-aged children who had an illness that occurred last week. So that's still around almost 300% higher than what we saw a year ago. Remember, the total numbers of cases being reported were a lot higher from the schools, about 6,300, but not all of those were cases that necessarily would have occurred last week or that we would have attributed to last week. So that explains the difference in that. In terms of vaccinations, Alabamians actually continue to do a pretty good job. We saw this week that there were actually 8 states below us in terms of having at least 1 shot given to their citizens. We were ahead of 3 other states in terms of having people fully vaccinated. Over 1.9 million Alabamians now are fully vaccinated. That actually represents over half of the state in terms of those who are eligible, not half of the total population, but in terms of those who are eligible. So we're pleased that we're improving. We still have a long way to go. But I want to dive into the subject of booster doses. I know we'll get a lot of questions on that. The FDA Advisory Council meeting, as you know, the VRPAC, is literally meeting at this moment. That's streamed on live right now online, and we've all been following that discussion this morning. They'll have a vote a little bit later today, and then we'll get an idea of what they're going to say. Frankly, at this point, I don't think we know what they're going to say. They probably will make some recommendations for some booster doses in certain populations. I don't think they're likely to say booster doses for everyone, but I don't know that. So we have to see what they vote. They are talking only about the Pfizer vaccine. They're not talking about other vaccines as well. So whatever guidance we get today is going to be, limited. We have actually a number of people who are getting 3rd shots. I saw that number a little earlier. It looks like about 36,000 3rd doses have been given. A little over 36,000 3rd doses have already been given in Alabama, just according to the records that we have. We don't know why. We don't know if some of those people are the immunocompromised people for whom additional doses are recommended, or if these are people who just sought out a 3rd dose because they wanted one or thought they needed one. So it's not clear at this point, but we'll try to get some more clarity on that as well. The other issue I wanted to spend a little bit of time on has to do with monoclonal antibodies. As you know, monoclonals are these drugs that are very effective in preventing serious illness and hospitalization and death in people who are either simply exposed to COVID or who have developed COVID but aren't yet sick enough to be in the hospital. On Monday afternoon of this week, our federal partners notified us that actually at 4 o'clock on Monday, that beginning at 5 o'clock on Monday, providers would no longer be allowed to order these drugs directly, but that all ordering would have to take place through state health departments. That's the rule they've applied to everyone in the country, not just to Alabama. They will allocate the total number of doses that we have available for our state based on our case numbers and our hospitalization numbers. So it's not clear how that formula is going to work and what that means for the total number of doses we're going to see at this time. They have also said, though, that they will cut our dose a little bit if doses aren't reported to them. That is, if they can't tell for sure that a dose has been given, if there's some uncertainty about whether it remains on the shelf or has been given, then that'll be subtracted from the amount that we get. So we worked very hard this week with many providers. We know there are a lot of stories from hospitals and clinics and urgent cares that had patients scheduled for monoclonals already on the schedule with appointments. We know the clock is ticking for those folks. We generally, as you know, try to give those drugs within 10 days of the onset of illness, and yet this has really disrupted the supply. So we are really sorry to say that there are probably going to be some patients who aren't able to access that drug, who thought they were going to have that available to them. We absolutely were not expecting this change in how the drug was distributed. It caught all states in the country off guard. We do have a plan in place so that providers can begin to order. They're going to get every Monday a opportunity to put in what they want to have shipped to them for the week. We will collect all those orders on every Tuesday and make those orders, and then those orders will begin shipping that night or the next day to providers so that everyone will be on this weekly cadence. Again, if our state as a whole is not using at least 70% of the monoclonals that are shipped here, then our allocation is going to be decreased. So it's really important for providers to order just what they think they need, but also to enter in what they're actually using, how much they're actually using, so that we can continue to get that valuable commodity for our state. Just a few other items. We do have HHS teams that have been in the state looking at Alabama hospitals, conducting assessments so that perhaps we can have additional help there. They've actually completed assessments at 8 different hospitals in the state, including DCH, Troy Regional, Flowers, North Baldwin, Thomas Hospital, RMC, which is in Anniston, and East Alabama, which is in Opelika. We are waiting to hear more. Clearly the problem is that there just aren't enough resources to go around. So we will let you know as soon as we can find out more. We certainly hope that we can have more resources like those that we have had, like those that we have right now in Ozark and in Dothan, who have been working there. So. We did actually have our first Kick COVID event last night associated with the University of West Alabama game. There'll be another one coming up this weekend at Jacksonville State. Congratulations to Jack State, by the way, on last week's win. But we're very excited that we're going to have these testing and vaccination options in place for a lot of these football games. You'll see more of them this next weekend as well. Ultimately, we're going to have at least 15 colleges in the state. They're going to be sponsoring this. And remember that not only allows for vaccination on game day, but also awards incentives for people who get vaccinated anywhere from 2 weeks before game day or 1 week after game day, as long as they go through the portal and sign up for that, and then indicate that they've been vaccinated. So we appreciate the work of the Bruno events team on doing that. They've done a terrific job. It's also been associated with a lot of public messaging, social media, just traditional radio and TV advertising as well. A lot of our college athletes have participated in that, and we really appreciate their willingness to do that. One final thing I wanted to mention that we've gotten a lot of questions about. Public health, as you know, can issue religious exemptions or other types of exemptions that are allowed under Alabama law to people who need vaccination for their school-age children. We actually only issue exemptions for school purposes, and so if there are reasons a child can't be vaccinated with a certain vaccine to attend school, then they can present that documentation to us, and we can create that exemption for them. This is not something that we are doing for COVID vaccine. COVID is not required for any schools, so we are not giving exemptions for COVID vaccines. People who are seeking exemptions for some other reason, for their employer or for some other reason, that is not something we're able to do through public health. We would encourage you to talk to your own medical provider about doing that if you need an exemption for COVID-19. We only are providing exemptions for those school mandated vaccines. So That's all the prepared comments I had right now, but I'll be very glad to answer any questions.
Dr. Harris,
Yeah.
what are some of the factors behind the limited monoclonal antibodies?
Yeah, monoclonals were limited, I think, more because of demand than anything else. We saw a real surge in the demand for that over July and August. Our initial call with the feds about this issue was about 2 weeks ago today, I believe, and they said at that time that 70 to 75% of all monoclonals in the whole country were going to about 6 or 7 states here, virtually all here in the southeast. And of course, we're states that have low vaccination rates. We have high case rates. And so I think the use was appropriate. We were using it in people that needed to get it, but there's simply not enough to go around for everybody. There's about 150,000 doses of monoclonals that are produced each week in this country for use by the whole country, but the demand has increased about 20-fold according to HHS in the past month. So it's gone up 20 times what it was before. We had some weeks where we were using small numbers, double-digit numbers of monoclonals, and now we're using hundreds or thousands sometimes at a time. So there's just not been enough to go around. So their plan was, instead of trying to figure out where to send it and trying to decide who gets what, they wanted state health departments involved in that, since we have a little better idea of what's going on in our own state. Our plan is to distribute those products, equally, fairly. So if we have, right now we have about 250 or so providers who are signed up to give those products. We'll look at the total orders they submit each week and then look at how much drug we actually have allotted to the state of Alabama and just try to equally distribute that, fairly, so that everybody gets their proportion of that. I would say we are going to, reserve the right to alter that formula a little bit if we have a place that's a real hotspot, or if we have a part of the state where there just aren't providers, where we just don't have enough, people giving product there. Certainly we could tinker with that formula a little bit, but our plan is just to equally distribute that to all the providers that want to give it.
Dr. Harris, last week I think you said Alabama's allocation would be cut to about 70% of what was requested. Is that still the case? And how does the supply compare with demand? Are there a lot of patients that need it, that can't get it?
Yeah, so that 70% number came from the call we had about 2 weeks ago, and it wasn't a hard cap or a formula. What they told us was, because so much of the product was going to these states in the South, they thought that in trying to redistribute it to other parts of the country, we'd probably get about 70% or so of what we had been getting, is how they put it. So I don't think that was ever a hard and fast formula. It seemed like it kind of got out and reported that way, but we were never told there was some hard cap on it. But they just said, for your planning estimates, that's probably about what you're going to get. At this point now, they've applied the same formula to everybody in the country, so that whatever your case numbers are is going to determine how much you get. So we're actually not sure yet what we're going to see. I think because this formula applies to everyone equally, and yet not every state is using them to the same degree as Alabama, it may be that we do have a decrease, but we'll have more idea next week. So. And what was the second part of your question?
Are there a lot of patients that need it that can't get it?
Yeah. I would say I think there certainly are some. Honestly, I have more concern about patients who don't know about it and don't know to seek it out, as well as even in some cases providers who don't know about it. We've done a lot of work with the Medical Association to try to educate providers on that. We've done a lot of messaging so that hopefully the public knows about that. We really have some real unfortunate situations right now, as the feds have sort of disrupted our distribution here, with patients who are actually sick with COVID, who were expecting to get it, who aren't going to be able to access it. But generally speaking, we have it in a lot of different areas. There've been a little bit of labeling changes, recently that makes it a lot easier to give in a doctor's office, as opposed to having to go to an infusion center or a hospital setting. So we actually have picked up, several dozen new sites just in the past month or so. A month ago we had less than 150 locations, closer to 100 locations giving it. Now we're, I think, over 250. So that's a good thing.
Dr. Harris,
Yeah.
you had said that you were advised at 4 p.m. and then at 5 o'clock that change went into place. Do you think Alabama, was that for all 50 states, or do you think Alabama is almost being politically targeted in a way based off of the numbers that we have?
No, that was for all 50 states. We actually had a call with every other state in the country at the same time, along with our federal partners at HHS. So it went into at the same time for all states, the entire country.
Okay. And do you think that hospitals like Huntsville Hospital that have had the monoclonal antibody treatment are going to almost run out by this weekend because of this distribution change?
I don't know. I'd say there may be some that have. I know Huntsville Hospital had some messaging around that. Our pharmacy team has just worked almost 24 hours a day trying to coordinate this with people. There are certainly some product around that can be moved, and so we've done that to the extent we know how or are able to get it to where the demand is until we get into more of a consistent, reliable distribution starting next week. There are some places that tend to be hospitals, although not exclusively, that have not only this Regeneron product but also the Lilly product. You may remember the story. The Lilly product was available, first of all, it became less effective against some of the emerging variants, and so the EUA was withdrawn for a while. It was actually given along with a second drug in a combination product. It takes me a minute to be able to pronounce it, but it's bamlanivimab is the Lilly product with a second drug as well. We call BAM-EDI for short. It's turned out that the variants that that drug was probably not as effective against have not really become the predominant variant. We were worried mostly about the gamma variant with those, and as you know, more than 95% of the cases in Alabama and the country are actually the Delta variant, and BAM-EDI works well for that. So EUA has been reissued. A lot of these facilities had that BAM on the shelf because they'd been told not to give it, and so it's becoming available again. It does have to be given with that second drug or as a combination of BAM-EDI, so it's not as simple as just pulling it out of the freezer, but we do have some stuff that's been stored in the state for a while, and that's helping to make up some of the difference.
Thank you.
Dr. Erica Thomas,
Let me go to the room here, and then we'll go to the phone in a second.
So you said at the beginning that there were 2 school systems that were not reporting numbers this week. What are some of the reasons why school systems might not report, and can you talk about the importance of them interacting and reporting?
Sure. I have to say I don't know exactly that. I don't actually know which 2 those were. I know our team is probably aware of that, but most of the time it's probably just a logistical issue. You know, the reporting falls on typically a school nurse who's really doing a whole lot of things all at one time, particularly if there's a lot of significant outbreaks going on. So it may be that they just didn't report in time, and we'll have that information a day or 2 late, which we can sort of retroactively put into the numbers. But it is very important for them to report. You know, we like having visibility on that. We don't really have any other way to capture where cases are occurring. You know, we don't have a lot of information about where anybody gets sick anywhere. You know, we know about outbreaks that occur, but it's pretty difficult to fingerprint that and say that we know which building you were in when you got sick. So it does help us a lot. I will say the schools have actually been very supportive. I think they like the transparency as well, so they can tell their parents, and people in their community what's going on, and it's just a real helpful way for all of us to understand the bigger picture. So, yeah, go ahead.
Doctor, forgive me if you covered this. Hospitalizations have significantly, well, not significantly, but have dropped over the last week or so, and we actually had fewer school cases reported than we had the prior week. Is there any reason to believe that Delta has peaked and now we're on the downhill side?
Yeah, I would say it's possible Delta has peaked, but I'm just not confident enough to say that. We've seen that Delta has gone through these sort of 2 month or so timetables in other states and in other parts of the world. We've really been having a lot of issues here for at least 2 months now. So it's a reasonable idea that maybe it's peaked and it's starting to decline just because we've had so many people infected, as well as we've increased our vaccination rate. So I would just say I don't know. It probably, given the numbers we have right now, none of that speculation really changes what our advice is. We still want people to get vaccinated as quickly as they possibly can. If you're going to be out in public with people that, from other households, please wear a mask, please maintain your distance, please do all the things you can to keep your kids safe at school. Maybe Delta's peaked, but again, it doesn't really affect what our guidance is right now. When we have, a much longer period of much lower cases, then we'll feel more confident about that.
And even though the hospitalization numbers are down,
ICU beds are still more than maxed out. Yeah, we still have more patients requiring critical care than we have ICU beds. And one thing I mentioned, you're just coming in, we also are continuing to have double-digit numbers of deaths, which accounts for some of the decline in hospital numbers. Yep, back to the phone there.
Oh, sorry. So the CDC recently released an analysis on Wednesday saying that the high obesity rate, or the number of states with the high obesity rate, went from 6 in 2018 to 16 in 2020. Do you think, especially along the southeast coast, do you think that has any correlation with the COVID deaths and like lung functioning and the amount of fatty tissues that are around the lungs?
There's no question that obesity is a relatively immunocompromising condition. That's a significant issue in Alabama. About 39% of our states considered obese. I'm in that category myself, and that puts us at risk for more serious illness. That's not just true for COVID. That's true for a whole lot of illnesses. I think that clearly a lot of what we've seen in the past 2 months in this state and in Alabama and in the country, is just related to the infectiousness of this variant. This variant is incredibly infectious, several times more so than any variant we've encountered before, and that has a lot to do with the numbers that we're seeing. But the issues that we're seeing here in Alabama specifically are related, I'm sure in part to obesity, but also to our general low measures of health of all sorts of other types. We've said this many times, but there's a lot of health disparity we see in our state, and COVID hasn't created a new one. It's just another example of the health disparity we've always had.
Thank you.
Thank you.
Dr. Harris, going back to the booster shots here, is ADPH prepared for this to the masses if it comes today? How likely is it? Do you think they might approve it today? And President Biden wanted to start Monday. Is that even likely?
Yeah. So the information that was released 4 or 5 weeks ago from the White House, put this date of September 20th on the calendar, and we were told even then right away. If you remember, the White House COVID-19 vaccine coordinator was here in the state later that week, Dr. Shuker, and he said this is just a rough timeline. It's not a plan. It's not an order. And so we weren't hanging our hats on that date. But the ACIP doesn't even meet till the 22nd and the 23rd. So I don't see any way that that's going to be implemented by the 20th unless something really changes. We are very prepared, we believe. We have been talking about booster shots for months. I think we've all realized they were coming. The difference between now and what we had in December is that we've had now I think more than 1,450 locations where people can go get a vaccine. In most cases on the same day that they want it, in most cases without an appointment, multiple locations in every county. So we have really tried very hard to completely flesh out our provider network around the state, and vaccines are widely available. There is no shortfall. We have, 1 million or more doses that are available to be given right away that are already here in the state, as well as more coming every week when people request them. So vaccine shortage is not an issue. We would expect that people are going to receive booster doses kind of in the same order as which they received their original doses. So we don't know if the feds are going to make that a requirement or a strong recommendation or not. But for most people, if the interval turns out to be 8 months after your first dose, there just aren't going to be a lot of people right now who are eligible for a third dose. There may be a lot of people who want one or who show up and try to get one. But 8 months ago was January, and we had not really vaccinated a whole lot of people in mid or late January, 8 months ago. The biggest surge would be expected, in December. Our biggest month for shots was in April. We gave over 500,000. We reached over 500,000 people in April, and so 8 months from then is when those folks would be eligible for a booster shot. If there's, it looks like there's some reason or some need that a community vaccination center or a mass vac site would be needed, we'd have plenty of time to do that. But we have vaccines available in essentially every single chain pharmacy, a lot of independent pharmacies, many doctors' offices, urgent cares, hospitals, clinics, community health centers. There's just so many places to obtain them right now. So we do feel good about the situation there.
And also monoclonal antibodies. 150,000 antibodies nationally. How much does Alabama normally get? And Dr. Thrasher was talking about how much he is praising some of our politicians, both local, state level, and in Washington, putting pressure on HHS to be sure Alabama gets its fair share into that. How important is that?
Yeah, we're very grateful for the people who have spoke out on behalf of our state to try to ensure that we continue to get our share. I didn't bring the numbers with me, Alan, but I think we got somewhere around the neighborhood of 8,000 or so doses of, that's both products. That's the Lilly product and the Regeneron product. Last week, the past few weeks have been somewhere in that neighborhood, and then we'll know soon what we're going to get for next week.
Dr. Harris, could you go into more detail about the money for travel nurses and how that process will work for hospitals?
Sure. So that we again, I just want to thank Governor Ivey and thank our state finance director, Mr. Bill Poole, for working with us on that. This is essentially a contract between the Hospital Association and a company called Vizient, which is a healthcare company based in Dallas that does a lot of things, but also helps with healthcare staffing. So with the money that we have available from state finance and a little bit of our own departmental money, we're able to hire nurses for what we expect to be about an 8-week contract. The price of travel nurses, is expensive, but it fluctuates a lot with the market and goes up and down. And so we were hoping to have, somewhere around 250 nurses. I don't know if it'll be quite that many, but certainly over 200 nurses that we're going to have available. And the Hospital Association is doing a survey of all hospitals to get an idea of what their needs are. We are particularly asking them to work on ICU capacity, expanding ICU capacity, because that's our biggest problem right now. As we've told you, we have seen our total number of COVID hospitalizations fall by around 500, 450 to 500 patients in the past couple of weeks, but we are still net negative in terms of ICU capacity. So that's what we would like them to emphasize. There are, some hospitals clearly in better shapes than others. There are some hospitals that can't afford to hire travelers and have been doing that for a while, and then there's some that just simply could never afford to do that. There are some hospitals that have the ability to expand ICU capacity and some that simply can't do that because of physical constraints, even if they had money and staffing to do it. So they're working on that. It does take 2 or 3 weeks to roll all this up together, and of course, obviously the staff's got to be found and hired and brought into the state. This company is not going to hire Alabama residents to be part of this because that was very important to us that they not just cannibalize the resources we already had, with people who are already working here. So I've not seen the final plan on that. I've had conversations this week with the Hospital Association about that, but ultimately the goal will be to expand our ICU capacity. 8 weeks from now, when this contract is up, then we just have to see where we are. If it's something that needs to be continued, then we certainly have some thoughts and have had some preliminary discussions about where we could find resources for that. But at least we'll have that contract in place and that relationship with that vendor, so it'll be a lot easier to continue. This is a group, I think I've told you before, that's been staffing in Missouri, I think since back in December. They've done staffing in Arizona, I think continue to do staffing in Arizona as well, and with some other state governments as well. So we're glad that we were able to find the resources to work with them.
Hey, Dr. Harris. Good morning. Can you hear me?
Yes, go ahead.
Can you hear me? Hey, awesome. This is Lisa from NBC 15 News here in Mobile. So basically my question today, there's been a lot of talk about vaccine mandates. And so let's say if an employer mandates the vaccine and that person gets sick from it, would that person be allowed to sue the employer in Alabama? And then that brings me to my question of, has there been any serious side effects, consequences to getting the vaccine? And would that feed back into vaccine misinformation out there that it's unsafe?
Yeah, let me tackle the second question. There's these vaccines are safe and effective, and there are certainly some rare side effects that have happened. People who have had anaphylaxis being the single most significant one, but that's still an extraordinarily uncommon consequence. There's a lot of data that people want to point to as under the VAERS, the VAERS, the Vaccine Adverse Event Reporting System. This is maintained by CDC, and I would encourage you to look at that. Remember, VAERS data can be reported by anyone. It's not verified. It's not investigated necessarily. But when CDC has looked into these reports of serious adverse events, there just aren't hardly any out there. In comparison, we know a lot about the serious adverse events of COVID, and in every single age group, COVID is much more dangerous than the vaccine, no matter what your age group. Even in our young adolescents and young teens who, in most cases, don't get all that sick from COVID, COVID is still much more dangerous for them on average than any vaccination would be. Again, these vaccines are safe and they're effective. We encourage everyone to take them. On your first question, I'm just not qualified to answer that. I think that's an attorney question.
Dr. Harris, this is Morgan with Fox 6 in Birmingham. Can you hear me?
Yes.
Oh, okay. Okay, thank you. Sorry, I think I messed up the mute thing. In the past couple of weeks, you've been talking about federal assistance with the monoclonal antibody treatment, setting up different sites. Can you give an update on that with federal providers there, or is that on hold with all of this other situation that's going on? And one more question, would it be fair, just listening to you kind of go through what the past week has been like and what everyone at the state has been doing to get these treatments out, would it be fair to kind of describe this situation as a mess? Or how would you describe it?
Well, let me, to the first question, the main provider we've worked with was recommended to us by the feds, and they're called KPMG. They've been in discussion with about 5 or 6 or 7 sites, and we're actually planning to go live very soon, but they are also affected in the same way because instead of just being able to directly order their own supply of monoclonals like any other provider, now all those orders are going through state health departments. So we're still working to try to figure out, what role we can play, to what degree we're able to staff them. I'm sorry, not staff them, but what degree we're able to supply them. And that's still a little bit in flux right now, but we certainly hope that we can have those up and running if it's possible to do that. But we'll let you know if that's going to happen or not. I'd say we're still not certain about that. I'd say the past week has just been a lot of work. It's been really stressful, particularly for our pharmacy team, who's just worked really night and day to try to develop this. I will say that it's not a completely unheard of arrangement in that, when the monoclonals first became available back in November, this is exactly how it was done. There weren't that many people using them, but all the orders did go through public health. And so we do have this system in place, even though we've just not scaled it up in the way that we need to right now. It's also similar to how the vaccine program was for the first 4 or 5 months, where providers made orders through public health, and we were able to coordinate the shipping to provider sites. So it's pretty similar to what we were doing. We certainly would have appreciated notice on that. We still have not gotten terrific explanation as to why this happened, and particularly why it happened so suddenly and without warning. But we have a great team here who's doing a really good job of getting it to work. So we hope by next Monday we'll have a lot of those procedure issues ironed out. Again, the real question mark is how much drug are we going to have in the state. That's going to, likely be the rate limiting step.
And just
Dr. Harris,
about just one more thing about the hospitals. You said that there were 8, I guess, that are under investigation or being assessed right now, including RMC and DCH. Do you have like a list of the priority hospital? Like, what would be the next place to get one of these teams outside of Ozark and Dothan?
Do we know? I'm gonna ask Jamie Durham to answer that question. I think he's got a little more visibility on that than I do. So.
Sorry.
Thanks, Jamie.
My pleasure, sir. COVID, move his chair so I don't get it infected. So this is Jamie again. So we have the essential elements of information. So hospitals that have asked for staff assessments, we have received about 10 more requests. I am actually working with our partners to identify the next 8. We should actually do some site assessments. We might try to do some of those internally with the state nursing director, our healthcare coalition coordinator, and a physician. So we're looking at potentially conducting some of these site assessments internally. Did that answer your question? No?
Yes.
Okay, and I don't have the 10 hospitals in memory, but how it works is the hospital sends essential elements of information to their local EMA. It is loaded into what we call a web EOC system, and I look at it every single night. I download it and put them in the queue for the next assessments.
Okay, thank you. And I'll send an email to try to get the specific information about our local hospitals, RMC and DCH.
That's perfect. You send it to Ryan, and I'll get that information to Ryan.
Thank you.
All right, sir.
Thank you, Jim. Thank you.
Dr. Harris, last week you'd spoken about the importance of not going for natural immunity over vaccine immunity, but I want to ask specifically about people who have already had COVID. We've gotten questions about whether they need the vaccine in light of some studies that suggest that natural immunity is holding up better, and that somehow maybe the vaccine might interfere with that. I guess if you could address that, first of all, do you concur that that is the science now, that natural immunity is holding up better, and is there some concern about, I guess, mixing vaccine immunity with natural immunity in some way?
Yeah, I'll start off and address that last point. I do not have any concern about people who've been naturally infected subsequently getting vaccinated. They absolutely should, and there's no question and no data that otherwise says that they're somehow more at risk or more at risk for adverse events or anything else if they're vaccinated. We know that people who have the most robust immune responses are those people who have been infected and who subsequently get vaccinated. And the MMWR report from Kentucky that I've talked about 2 or 3 or 4 weeks in a row shows that those people who had natural immunity because of infection and yet were vaccinated had a significantly decreased risk of subsequent infection. I think it was 3-fold or more. We have had thousands of people in Alabama who've been infected at least twice, and some of them 3 times or more, or even more. The mortality rate for those people is a little bit better the second time around or the third time around, but it's not great. It's still on the order of about 1%, 1 per 100. We've had 0.01% of vaccinated people in Alabama who've died from infection. Many of the questions about natural immunity are people who are just skeptical of the vaccine in the first place, and I wish that wasn't the case. If you've been infected naturally, then the very best chance you have to protect yourself is to get vaccinated on top of that. You're really going to be the rock star in this whole pandemic if you've got natural immunity on board and also have been vaccinated. That's the best possible protection you could have.
And what are the most current numbers on people who've had repeat infections versus the breakthrough infections?
Let's see. I've got it somewhere. Right now we've got just under 8,600 people we know of who are infected with COVID more than once, and we've had 75 deaths in that group that we know about.
And then what about those same number of breakthroughs?
Let's see. We have had a total of, let's see, let me find that for you. Let me try to pull that together, and I'll get that to Ryan for you. I'm sorry, I'm just not putting my hands on that right this second.
All right, yeah, thanks.
Sure.
Dr. Harris,
Yeah.
so going kind of back to COVID deaths, there was reported 192 deaths added, but does that accurately reflect kind of who is dying every single day in the hospital?
No, absolutely not, and that's the point I was trying to make. That the numbers that we get reported are confirmed deaths, and it can take us a couple of weeks, to make sure deaths are confirmed. The numbers that we're seeing from the Hospital Association are being reported by their members each day to them, and so those show, a few dozen deaths a day. They're going to be posting that themselves. I think I mentioned earlier. And I don't have any reason to doubt the accuracy of that, but the numbers that we're reporting actually have to be investigated. There's a case investigation, and they have to be verified before we post them. So, it's the same. The numbers are never going to match up, and they're not even the same people, because we're looking at deaths sometimes that happened 2 or 3 weeks ago before we actually post it on a given day.
Dr. Harris, on booster doses, you said that's initially at least going to be just for 5 people who had the Pfizer shot. What about people who had Moderna and Johnson & Johnson? What's the outlook for them?
Yeah, I think eventually there are going to be booster doses for all those people, probably eventually. But again, there's not enough data for the FDA to say yet, and that's what they announced this past week, that they're not going to consider those yet because they just haven't seen enough data there to do that. So. Eventually, I think we will. A real important point to make, I don't think I've said this today, even these people that have declining antibody levels are still really well protected against serious illness and hospitalization and death. And I think that's a lot of the controversy about booster doses. We do see after 6 months or 8 months your antibody titer go down, but that's not the only part of your immune system involved in protecting you. And so even if you're a little more likely to actually get an infection, it's probably going to be a mild infection. So, some of it just has to do with helping people understand the purpose of the vaccine. I mean, we want the vaccine to prevent you from getting infected, but, even the very best vaccines in the world are, going to miss 1 out of 10 times or 2 out of 10 times. But what the vaccines are really, really good at is keeping you from getting very sick if you do get infected. And that protection still seems to be holding up even in these people who are 7 months or 8 months out from their second shot. Okay, any other questions?
I have another.
Oh yeah,
sorry.
sure. No, go ahead.
Do you know the specific amount of people who got vaccinated at your first kick COVID event yesterday?
I do not know that. I'm sorry, I don't know that, and I think we'll start being able to get that and report that to you. Part of the issue, again, is that they're taking people who are signed up for the program and who get vaccinated in the 2 weeks before or 1 week after. So, the numbers we're going to attribute to the site aren't all going to be just from game day. We can try to get that number too, but each school is going to have, about a 3-week range of shots that are all going to be associated with that event that, we hope we can honestly say we can attribute to that event. So. All right.
I have a question.
Yeah.
Has the ADPH specifically addressed any possible issues that refugees from Afghanistan or American citizens coming back from Afghanistan might have with getting the vaccine?
No, I would say we've had no discussions on that. No one's reached out to us on that at all. All right. Thanks, everybody. Thanks for joining us.
And that was Alabama State Health Officer Dr. Scott Harris giving his weekly COVID-19 press briefing. And once again, Phil Pinarski here with CBS 42 Now. I do want to very quickly go over some of those main topics that were discussed by the state health officer. Again, if you look on your screen right there, right across from me, that is, of course, the COVID-19 dashboard courtesy of the Alabama Department of Public Health, which you can find at any time of the day over on our website, cbs42.com. Dr. Harris, of course, started the press briefing like he always does by giving some of the basic numbers surrounding the ongoing pandemic. He's saying probably that one of the main topics that will be talked about throughout the newscast today here on CBS 42 is the fact that Dr. Harris says that 2020 was the first year in Alabama state history where we saw a decline in population with more people dying than being born. He says that it's never happened ever in the state history, including during multiple wars, as well as with the flu outbreak back in the early 1900s. Some of the other main topics was 192 deaths were reported in the state just yesterday. Again, that's not how many people died yesterday, but how many were reported over the past few days. Dr. Harris saying that it takes a couple days or even a couple weeks sometimes to get all of these deaths confirmed, but 192 were just reported yesterday. The good side, though, is that there is a slight decline in hospitalizations across the state, although Dr. Harris did say that it may not be as good as it may sound because hospitalization rate could decrease if more people are dying as well. As far as school district goes, Dr. Harris saying that there are just over close to 6,400 cases reported from all the school districts. All but 2 school districts in the entire state have been reporting their case numbers to the Alabama Department of Public Health, and about 2,900 school-aged children have the illness, which is about 300% more than this time last year. Again, vaccinations do continue to increase here in the state of Alabama. Right now, the vaccination rate in the state is higher than about 8 states across the rest of the country, so definitely some improvement there, and Alabama is ahead of 3 states at this time for fully vaccinated individuals in the state. He also made mention of monoclonal antibodies. Again, we did have the Medical Association of the State of Alabama's weekly COVID-19 press roundtable discussion. Dr. Harris was on that call, as well as Dr. Michael Sag with UAB. They discussed the monoclonal antibody treatment. There will be some changes as far as how much the state is given with that treatment, and we do have more information on that treatment over on our website, cbs42.com, which is where you can find this press briefing in its entirety there as well, in case you missed anything or want to go back or share it to somebody else and sort of answer some of their questions as well. Again, that will be up in just a few short moments. I do want to thank you all for tuning into this latest edition of CBS 42 Now. I'm Phil Penarski, and we hope you have a great rest of your day.